orthopedic surgeon and sports medicine physician, and today I'm talking about professional bull riding and the PBR. Yep, that's what I'm doing. So shout out goes to Kyle Gibbs for giving me the idea to do this video, and actually there were several of you that suggested that I do this, and so I finally got around to looking at professional bull riding. And we're gonna talk about that today. We'll analyze some video of bull riding wrecks so that we can learn more about the injuries that may have occurred and the mechanism of injury that was involved. Be sure to stay tuned to the end of the video so you can see what has been described as one of the most violent bull riding bouts in the history of the sport, which has been around for a long time. The most violent, or one of the most violent anyway. Professional bull riding has been described by some as the most dangerous 8 seconds in all of sports. This sport can be summarized very simply by saying that you have a man who's trying to ride a bull who does not want the man to ride him and who tries to get the man off in a rather precipitous fashion. To score, the man has to stay on the bull for a total of 8 seconds using only one hand on a bull rope, touching the bull or himself with his free hand, or failing to stay on for a total of 8 seconds equals no score. Each ride is scored by a total of 8 judges, 4 for the bull and 4 for the rider. And each the rider and the bull can score a total of 50 points. For the bull, basically, the harder the bull, the higher the score. And for the rider, the better that he rides, or the longer that he stays on, the higher the score. A perfect score is 100 points, but the average score usually ranges between 70 to 80 points. And although bull riding is popular in the United States and Canada, it is quite common sport in many countries. Now, obviously, anytime that you combine a human being with an angry animal that weighs upwards of 1,500 to 2,000 pounds, injuries are quite likely to occur. So before we look at the videos, let's just look at some of the stats concerning bull riding injuries. In a recent 3-year retrospective review by Sinclair et al., the authors found that injuries occurred in rodeo riders with an incidence of 1.69%, or 16.6 injuries per 1,000 competitor exposures. Nearly 89% of all injuries came from rough stock riders. Now, rough stock is a term that is used to describe bull riders, bareback bronc riders, and saddle bronc riders. And when they looked at the group of rough stock riders, bull riders were the most likely to be injured with an incidence of 48%. Most of the injuries that these riders suffered came from either collisions with the ground, collisions with the animals, or being stomped on by the bull. In this study, the most common injuries were contusions, 23%, sprains, 14%, and concussions, 12%. The most common injured body parts included the neurologic components, both the brain and the spine, at 13.4%, and the knees and shoulders, both at 11% each. This study showed that the majority of injuries occurred during or immediately after the dismount. And that should come as no surprise, because the bull doesn't want you to ride it, and it's trying to kill you. So now that we've talked a little bit about bull riding, let's watch some videos so we can learn more about the injuries and how they occur. So for this first video, we have a rider named Jess Lockwood riding a bull named Wild Goose for the 2019 Global Cup. And in the Global Cup, Jess Lockwood is competing for Team USA. Unfortunately for Jess and for Team USA, this particular ride does not last very long. After coming out of the chute, we can see here that Wild Goose bucks 2 or maybe 3 times before Jess Lockwood is thrown off. That as Wild Goose is bucking, Jess Lockwood is thrown over the left shoulder of the bull. The horn on the left-hand side of the bull's head impacts Jess right in his left collarbone. And then he's immediately thrown off the bull to the right-hand side and to the ground. And immediately when he's on the ground, we know that something is not quite right because it takes him a second or two to get up. And we can see that he is not using his left arm as he does so. He walks back to the chute with a grimace, cradling his left arm. And later we can see him walking around behind the scenes and reaching up to his left clavicle. Jess was subsequently confirmed by radiographic imaging to have suffered a left clavicle fracture. If this fracture is minimally displaced without significant overlap, this is something that can be treated non-operatively with sling immobilization for a period of approximately 6 to 8 weeks, and it will heal just fine. However, if this fracture is significantly comminuted, meaning there's a lot of pieces, or significantly displaced, meaning the fracture ends are far from one another and not at all touching, then this is something that will require operative fixation. And this is something that would typically be done with a pre-contoured, meaning pre-bent plate and screw fixation. Anticipated healing time would be between 6 to 8 weeks. All right, so I know what you're saying. Dr. Chris, that was just the collarbone. Yeah, whatever. That was just the warm-up. Let's get on to the next one. So for this next video, we have a rider named Sean Willingham riding a bull named Wilywood Blue. Like, who comes up with these bull names? Like, really? So this matchup is from Kansas City of 2019. Sean manages to ride this bull for approximately 5 seconds before getting bucked off. Sean gets bucked off to the bull's left and lands on his knees on the ground. He doesn't appear to be hurt initially, but unfortunately, he is unable to get out of the way in time. And as I mentioned previously, if you are not injured by being thrown to the ground or through a collision with the bull, then you are most likely to be injured by being stomped on by the bull. And here we can see exactly that. As Sean is kneeling on the ground with his back to the bull, we can see here that Wilywood Blue comes down and stomps on Sean's left leg before he kicks Sean in the back for good measure.
Get right here, man.
Eventually, at some point, the bone is gonna give up and cry uncle, and then you have a fracture. The severity of the fracture and the degree of displacement and soft tissue injury will determine the type of treatment that Sean receives for this injury. If the fracture is minimally displaced and the soft tissue injury is not significant, then this is something that can be closed reduced in an emergency setting and treated with cast immobilization for a period of approximately 6 to 8 weeks. Given the weight of the bull and the energy of the injury, I would suspect that this fracture was significantly displaced and that Sean had to undergo operative management of this injury. We can expect that we probably won't see him for a period of between 4 to 6 months before he returns to competition. So for the next one, we have a rider named Guyton Sosi riding a bull named Wicked. To me, that sounds like a bad idea. So as with the last clip, we can see here that the ride doesn't actually go too badly for Guyton. He's not actually able to stay on for the full 8 seconds, but he is able to ride the bull for approximately 5 or 6 seconds before being thrown off. We can see that once again, he is thrown off with his back to the bull. Although I've only watched a few of these clips, there's one thing that I know already, and that is, if you're gonna be in bull riding, you need to have eyes in the back of your head so that you can see what that animal is doing at all times. Before Guyton is able to get out of the way, we can see that Wicked charges him and then stomps on him approximately 2 times. And although he's underneath and rolling around the bull, Guyton actually appears to be okay until he gets stomped on by Wicked for the 2nd time. And we can see from the overhead view that when Wicked stomps on Guyton for the 2nd time, that his right rear leg comes down directly on the mid shaft of Guyton's tibia. And all of that weight of the bull directly on the side of the tibia means that there is a whole lot of tension or a whole lot of bending force on that bone. And what is it that I always tell you, like in almost every freaking video? Bones are really good in compression, but they suck in rotation, and they're not that good in tension either. Bending, they don't really hold up to tension very well. Unfortunately for Guyton, here he suffers a mid-shaft diaphyseal. That just means in the middle of the bone, in the long portion of the bone, a mid-shaft diaphyseal tibia fracture, as well as a fibula fracture at that level. If I had to guess, because of the significant compressive force caused by the large weight of the bull, I would probably say that this fracture was comminuted. You know, many pieces. Given that likelihood, then I would say that Guyton would have to undergo operative fixation, in this case with intramedullary rod. That means a titanium nail that would go down the full shaft of the tibia from the knee to the ankle, as well as plate fixation of the fibula, the smaller of the two bones. And indeed, Guyton did undergo surgery for the fixation of this fracture. Normally, we could expect a fracture of this type to take approximately 2 to 3 months to heal, if there was not significant comminution. In this case, I expect there to be lots of pieces and a significant soft tissue injury, so we could expect that this fracture might actually take longer than that to heal. An interesting point to note is that the intramedullary nail, since it goes down the middle of the shaft of the tibia, it serves as a load-bearing device. In other words, it is able to support the entire weight of his body when he ambulates. And this means that with this type of implant, Guyton should be able to walk on his leg a lot sooner, and in fact, before the fracture is actually totally healed. And this is quite different than fixation with plate and screws, which are load sharing devices. These type of implants do not allow you to bear weight on the extremity while the fracture is healing. It is only after the fracture has healed that you can bear weight if plate and screw fixation has been used.
Wow.
So for our next clip, we have a rider named Bonner Bolton riding a bull named Cowboy Up. Now, if you watch the show Dancing with the Stars, many of you may be familiar with Bonner Bolton from that show. However, before he was on Dancing with the Stars, he was a professional bull rider. And in this video, we can see that Bonner fared better than most of the other riders we have shown you thus far. He actually rode the bull for the full 8 seconds. Bonner tamed the beast, or so he thought. If you recall what I told you at the beginning of the video, many of these injuries occur at the time of or immediately after dismount. And we've seen several of the other riders who have been injured after they have been thrown from the bull. In this particular case, as Bonner attempted to dismount the bull, Cowboy Up lived up to his name. And he basically ejected Bonner directly up into the air for a height of approximately 10 feet, after which Bonner landed directly onto the top of his head, like with all of his weight from a height. And generally, that's not a good thing. Bonner stated in an interview that he knew immediately that this was a bad injury because at the time, he was completely paralyzed from the neck down, unable to move in any way, shape, or form. Bonner was immediately taken to the hospital, where X-rays and MRIs showed that he had suffered a fracture of the second cervical vertebrae, the C2 vertebrae. The type of fracture that Bonner had suffered is known as a hangman's fracture, and it is quite commonly seen in people who have attempted to hang themselves. Hangman's fracture is the name given to a fracture that involves the two pedicles or the two arms that extend from the back of the C2 vertebrae. And the outcome of this fracture is quite commonly death. Now, obviously, Bonner Bolton didn't die because we saw him on Dancing with the Stars. In his particular case, the fracture was minimally displaced. Bonner states that there was some deliberation at the time of injury as to whether this fracture would be treated conservatively with halo fixation or whether operative fixation would be more appropriate. And in the end, they elected to go with operative fixation. Through a posterior approach, meaning they went through the back of the neck, Bonner's surgeon performed a posterior stabilization and instrumented fusion. They fixed the fracture from the back using plate and screw fixation. And by fusing the second and the third vertebrae together to create a solid unit. After a period in hospital, Bonner began to experience a return of sensation and motor function in his body and extremities. Eventually, he was able to regain full use of all of his extremities. However, as a result of the proximity or closeness of the surgical implant to the vertebral arteries in his neck, Bonner's surgeon told Bonner that he would never give him clearance to return to riding again. Fortunately for Bonner, I guess it appears that he can dance because he was able to obtain a position on Dancing with the Stars, which is where many of you may know him from. So for this next one, we have a Brazilian rider named Alex Cardoso riding a bull named Firehouse. We can see that Alex manages to hang on for approximately 3 to 4 seconds before being bucked off by the bull. Unfortunately for Alex, he lands directly onto his head in much the same way that Bonner Bolton did. However, in this particular case, we can see that he is able to move and he does not suffer any immediate paralysis. But as soon as he is able to stumble forward into the chute, we see that he collapses forward onto the ground in obvious pain and agony. We know that at least at this time, he has not suffered any neurologic injury or injury to his spinal cord or nerves because he is able to move all 4 extremities. In addition, we know that his spine is structurally stable because he is actually able to stand upright. However, we do know the potential for injury is quite high because of the injury mechanism. Spinal injuries or spinal fractures are 2 of the things that should first come to mind whenever somebody lands directly on top of their head. And although he is able to move, we can see the workers here preparing the spine board so that they are able to transport Cardoso safely for further assessment. I wasn't really able to find much information here about what happened to Alex and what treatments he underwent, but I was able to find out that he had suffered fractures of both his cervical and his thoracic spine. He was noted to have suffered fractures of the C6 and C7 vertebrae of the cervical spine, as well as the T5 vertebrae of the thoracic spine. Based on the fact that he was able to move immediately after the injury, I'm venturing to guess that these fractures were likely minimally displaced compression fractures of those respective vertebrae, meaning that those vertebrae were likely compressed from top to bottom by some degree without them suffering a loss of structural stability. If these fractures were neurologically stable, meaning with no injury to neurologic structures such as the spinal cord or nerves, as well as structurally stable, meaning that there was no loss of the relationship of the vertebrae to one another or their ability to maintain the overall alignment of the spine, then these fractures could be treated non-operatively with cervical collar immobilization and thoracolumbar sacral orthosis, or in other words, a clamshell brace. These fractures could be expected to heal within a period of approximately 2 to 3 months, after which time he could begin physiotherapy, and eventually he would be able to return to competition. And finally, the one that you've been waiting for, the one that has been described as one of the most violent bucks of all time in this sport, we have Tuff Hademan riding Bodacious. Bodacious was known as one of the baddest bulls in all of bull riding history, and he eventually was retired because he was just that dangerous to ride. And in this clip, we can see that it is not too long before Tuff gets into trouble riding this bull. Bodacious bucks a few times, and as he does so, we can see that Tuff starts to fall forward over the top of the bull. As he is falling forward, we see that the bull bucks up, smashing his head directly into Tuff's face before throwing Tuff off the back of the bull. Tuff lands on his side and rolls around on the ground a few times before rolling onto his hands and knees. And right away, we know that something's terribly wrong because we can see that everyone, and I mean everybody, are running to his aid. Interestingly enough, this injury was from 1995, and at that time, many of the riders were not wearing helmets as this was deemed to be an unnecessary part of the sport. Okay. On the slow motion replay, we can see that Tuff's face struck directly on the top portion of the bull's head as he reared back upwards. And we know that this is the hardest part of the bull's skull. Although it is difficult to tell from the video the degree of damage that he has suffered, we can see that his face is bleeding like a faucet, and there is blood all over his face and all over his clothes as he leaves the arena. After arriving at the hospital, radiographic imaging showed that Tuff had suffered a significant facial injury with fracture to all of the bones on the front of his face. And this includes his maxilla on both sides, left and right, as well as his nasal bridge. This fracture is more commonly known as a Lefort 2 fracture. These fractures require 2 surgeries, 13 hours, and 6 titanium plates in order to be reduced anatomically. So it just goes to show that in the sport of bull riding, even when you can walk away from them, the injuries can still be brutal and severe. So what's the bottom line? Well, professional bull riding is hella dangerous, with a high incidence of significant injury, some of which can be life-changing. So there you have it. Today I've been reviewing professional bull riding and PBR WRECKS. If you liked the video, be sure to give it a big thumbs up and share it with somebody that you know. If you're new to the channel, be sure to subscribe and hit the notification bell so that you can be notified when we post new content, because otherwise YouTube just might not tell you. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.